Driving ourselves where and when we want to go is fundamental to our sense of independence. In fact, the vast majority of us will outlive our driving retirement by a decade. While 42% of area agencies on aging offer older driver safety training so that we can stay on the road longer, fewer than 4% offer programs that help people to transition when we need to retire from driving to using alternative transportation service that can enable us to remain independent and active. According to a recent study, for every dollar spent on travel training services, transportation agencies saved between $200,000 and $440,000 annually.
JCA has a program called Connect a Ride, which is a telephone-based helpline that people can call, whether it's a social worker or the client themselves, asking about different transportation options. The information specialists that answer the phone really talk to the individual, find out what their exact needs are, and talk them through the process of whether public transportation is an option for them. RideSmart targets the entire population in general, whether it's people who still drive or people who need a refresher course in public transportation. It's still the 2-day class of the classroom training. The second day we bring a WMATA bus and give them the full tour of the bus, teach them how to use SmartTrip cards, purchase them, load them on the bus, load them at a metro station.
I don't see any reason really to be scared of the change. Getting into it like slowly. I've had the information about it, so I've got time to practice, and it'll be fun.
It gave a lot of people a new perspective that they're not stuck, and if they give up their car, they're not going to be stuck. That they can get around, they can learn a new skill, they can go places on their own.
It really was an emotional thing. I was depressed, really depressed. What can I do? What I'm going to do? I lost a job.
Retiring from driving is a major life event that has measurable impacts on the health and well-being of older adults. According to the Surface Transportation Policy Project, they take 15% fewer trips to the doctor, 59% fewer shopping trips, and 65% fewer trips for social, family, religious, and other life-enhancing purposes.
I stopped driving about 3 years ago because of the fact that I had a very common disease in the eyes due to older age. It's called macular degenerative disease of the retina. I didn't like it at all. I liked the ability to be able to jump in my car at a moment's notice and go and do what I wanted to do.
I gave up driving about, 07, 6 years ago. I don't want to drive now because the people are driving so crazy.
Our target audience for this program was age 50 plus, low-income seniors in the CSEP program, which is the Senior Community Service Employment Program. Out of those people, it was surprising the number of people that did not want to participate, even with the encouragement of you'll get a SmartTrip card, you'll get money on the SmartTrip card, you'll get a gift card to a thrift store. And their response was they drive, they don't need public transportation.
AARP surveys found that nearly 3/4 of older adults want to live near public transportation services. Yet, even when people 65 and older have access to public transportation, only 15% of them reported having used it in the last month.
For older adults, the most successful approaches that we've seen are group training, teaching someone how to travel to somewhere fun, somewhere exciting, making travel on public transportation a really positive and fun experience. Lots of times older adults have driven their entire lives, so making that first trip on public transportation a fun and positive experience, that's really successful.
I was always afraid. I was afraid of not knowing how to use the card. I was afraid not knowing how to get places. So I said I would learn, and I feel I did.
One major study of travel training programs concluded that program participants substantially increased their use of transit and took more overall trips following the training, which suggests reduced risk of social isolation.
It may take me a little longer to get to places, but I'll be able to relax, read a book, enjoy the scenery, which you really can't do when you're driving. At this point, I'm looking forward to it.